This video will cover the immediate postpartum period. Our takeaways will include defining the immediate postpartum period and understanding what your care team may do to help keep you and your newborn safe during this time. The first 2 hours after birth is often called the immediate postpartum period. It is an exciting time of great change where you finally get to meet your baby after months of waiting. While it can be a joyous time of getting to know your little one, the transition from pregnancy to postpartum for you and in utero or inside your uterus to extrauterine life or outside your uterus for your baby can be a time of increased risk. Careful watch over both you and your newborn occurs in these first 2 hours to ensure if either one of you needs additional help, it is provided to you in a timely manner. To make sure there are enough hands in the room if you're giving birth in the hospital, a second nurse tends to come in the room for the birth. They stay in the room through the birth and until your care team thinks it's safe for them to leave. One of the greater risks during the first 2 hours is postpartum hemorrhage. To help combat this risk, your care team will most likely follow recommendations from the American College of Obstetricians and Gynecologists and the Association of Women's Health, Obstetric and Neonatal Nurses. These guidelines include frequent assessment of blood pressure, heart rate, and fundal checks, normally in 15-minute intervals for at least 2 hours. Your fundus is the top of your uterus. Your caregiver will massage your fundus to make sure it is firm and to determine its location. Uteruses that are firm are less likely to bleed. They're also checking to see how much you're bleeding with each check and making sure your uterus is staying in about the same spot. If your uterus has moved too far out of place, it puts you at a greater risk for bleeding. Things like emptying your bladder or getting extra clots or blood out of the uterus helps to move it back into place. There are medications that can be given if you are bleeding too much. By 2 hours, the care team will most likely help you to the bathroom and encourage you to use the restroom to empty your bladder, if not sooner. Keeping your bladder empty after birth does help prevent postpartum hemorrhage. If you did have an epidural, your legs will normally regain their strength and feeling by about that 2-hour mark. Your caregiver will want to be with you the first time you get up, regardless of if you had an epidural or not. If you had a C-section, the assessment in the first 2 hours looks similar, with the addition of assessing your incision site with your blood pressure, heart rate, and fundal checks. With a C-section, you will be getting up by about 6 to 8 hours after birth, instead of 2 hours. You'll also have a catheter in your bladder that empties your urine for you, and that will be removed when you're able to move around more independently. Your baby will also need close assessment while he or she transitions to living in the outside world. The caregivers will assess your newborn right at birth and give your newborn an assessment score at 1 minute and at 5 minutes of age. This score is called an APGAR score. APGAR stands for appearance, pulse, grimace response or reflexes, activity, and respirations. Each is scored on a scale of 0 to 2, with 2 being the best score. Scores range from 0 to 10, but few babies ever get a 10 because their hands and feet tend to stay blue until they've warmed up and have learned to pump their oxygen throughout their body better. The American Academy of Pediatrics and American College of Obstetricians and Gynecologists also puts forth guidelines that your newborn should be assessed at least once every 30 minutes until they have been stable for about 2 hours. Sometime during the first 2 hours, your baby will be weighed, measured, and will receive their newborn medications. Please see the video on newborn medications for more information. Thank you for watching this video on the immediate postpartum period. I hope you have a better understanding of our takeaways, defining the immediate postpartum period, and understanding what your care team may do to help keep you and your newborn safe during this time. Thank you.